Okay. Oh, joy.
We have to have a quorum to call the meeting to order, don't we? Or can we have a presentation?
I don't think so. I think we just can't vote on anything.
Hello.
Hello, Joda. Good morning.
Uh-oh. There. Mute my audio, Kurt, on my computer?
Yes.
Okay, I only muted it on Zoom, so hopefully that's better.
Yeah, let's try and say hello to Sandra.
Hello.
Okay.
Good morning, Joda. Can you hear us?
Well, I can hear you. Can you hear me?
We can. Yeah.
All right, great. Finally. I still struggle with this.
I totally understand that. We appreciate you joining. We're waiting on just a couple more board members, so we'll give it just a couple more minutes and then we'll get started.
Okie dokie.
Oh. Or do we just reschedule and... I mean, I guess it's being recorded. So.
Yeah. I talked to Peter on Monday. And I talked to Leah this morning. So hopefully both of them will be able to join and are just running a little late.
Porter was checking on us. I gave him the thumbs up and said,
What's that?
Porter was checking on us.
Oh, that's very kind. There's Peter. Leah. All right, Kurt, are you ready?
Yes.
Okay. We don't have a quorum, but we can at least get the presentation started. Good morning, everyone, and welcome to the Special Alcohol Funding Advisory Board meeting. It looks like we are just about ready with our board members, so I will pass it off to our board chair, Leah.
Hi, good morning, everyone. This is Leah Roseland, Chair, and we will call the meeting to order at 8:33 is what I have. So next we will do roll call. Danielle, or Casey, is there a specific way that we should do that?
I don't think there's a specific order or anything like that you need to be cognizant of.
Okay. So, Peter?
Here.
Joda?
Here.
And then I'm not sure if there are other members. I don't know what the names are on the other ones.
Ethan just notified me this morning that he had something come up, so he will be unable to attend. And then Galena Miller is the other board member, and I have not heard from her yet, so hopefully she will join us a little bit later, and it's just running a little late.
Okay. Should we proceed, though? Do we have any decisions to make today, or?
We do not currently have a quorum, but we do have a presentation from DECA. We have Sandra Dixon here. So I do want to be cognizant of her time, and so we can go ahead and move forward with that presentation, but we won't be able to make any action tonight, or this morning, I'm sorry, unless we are able to reach a quorum.
Okay. Thank you for that clarification. Danielle, would you please give a few remarks about how we should conduct the meeting?
Yes, absolutely. Thank you very much. Good morning. My name is Danielle Bushcutter, and I will be facilitating the Zoom video portion of the meeting. This meeting is being recorded and broadcast on the city's YouTube channel and public access cable channel 25. During the meeting, please mute yourself by clicking on the microphone icon found on the lower left-hand side of the Zoom menu next to the video icon. When you are muted, a red line will appear over the icon. Muting your microphone during the meeting will make it easier for everyone to hear. You'll just have to remember to unmute if and when you want to speak. In some cases, I may mute or unmute people as needed. And each time you speak, please remember to state your name and title for the benefit of those listening remotely. In the menu, you can also turn your camera on or off by clicking the video icon. For the purposes of this public meeting, please keep your video on during the meeting. If you're participating by phone, you can click *6 to unmute your phone. For those using Zoom, somewhere on your screen, you will see a choice to toggle between speaker and gallery view. Speaker view shows the active speaker, while gallery view tiles all the meeting participants. Now I will turn the meeting back over to our chair.
Thank you, Brent. So we are joined this morning by Sandra Dixon at DECA. The board was interested in learning a little bit more about what the needs are around recovery and drug and alcohol intervention and prevention services in our county. And DECA leads our community and expertise in this area. So we are so thankful and appreciative, Sandra, for you to spend time with us this morning to prepare us to making these very important decisions to the best of our ability in service to our community. So I will pass it over to you unless there's some technical thing that needs to happen.
This is Danielle Bushcutter, Staff Liaison. I will pull up the presentation that Sandra sent over yesterday, and then the floor is all hers.
Thanks, Leah. Good morning, everybody. Thanks for inviting me to share this morning. My name is Sandra Dixon. I am Chief Clinical Officer at DECA. I have about 15 minutes this morning of information to share. It's actually quite a bit more than 15 minutes, but I'm going to try to run through it succinctly and leave a few minutes for questions. I do have to be on another meeting at 9, so I'm happy to answer additional questions in the future. We really appreciate the work that you all do as this advisory group. DECA has been a beneficiary of the Special Alcohol Fund for as long as I can remember. I've been in this role for 12 years. And I'm going to talk a bit about how that fund has been used at DECA over the past few years. Okay, Danielle, can you go to the next slide, please? So my objectives very quickly this morning, I'm going to give a bit of an overview about our organization here in Lawrence if you are not familiar with everything that we do. I'm going to share a few snippets of data about what's happening in our community. I'm going to talk a bit about treatment and recovery services in this community, some prevention initiatives in this community. Danielle asked me to also speak a little bit about some of the broader county initiatives, and I'm going to focus on the ones that DECA is engaged in. And then a bit of a conversation about how we see gaps and opportunities, particularly in the area of prevention, treatment, and recovery. So who are we? We are a Lawrence-based statewide organization. We're a nonprofit. We've been here over 45 years. We are planning our 50th anniversary as we speak. I oversee all of our behavioral health services. We operate 5 addiction treatment programs in the state, 1 in Pittsburgh, 1 in Pratt, a large one in Wichita, and then we have 2 here in town. First Step at Lakeview, which is our residential program for women and their children, and then Lawrence Outpatient Services, which is on East 23rd Street. We're also a licensed child placing agency, and what that means is we recruit, train, and support foster families who care for children in the foster care system. We're also a family preservation contractor with DCF. That means that we are serving families who are high risk for having their children removed into foster care, and the work that we do is trying to keep them together. One of the unique things we do in family preservation is an evidence-based model that specializes in serving families where parental substance use is a risk factor. So it's a really nice blend of our treatment and child welfare experience. We do that in the Kansas City region, which includes Douglas County, and in the 10 counties surrounding Wichita. We are the Kansas Traffic Safety Office. So if you see the click it or ticket or the drunk driving prevention, we distribute car seats. We do all of that out of Topeka. We are a statewide prevention contractor. We work in communities throughout the state and in Oklahoma on substance use and mental health prevention, specifically opioid use prevention. And I'm going to talk a bit about our Douglas County initiatives here in a few minutes. And then we are nationally accredited by the Council on Accreditation. So we have a whole team of people who help us with quality improvement and research to be sure that our services are meeting the needs of our communities. Next slide, please. So just a few pieces of data. So what's happening in our community. Our prevention team facilitated 14 focus groups last spring with 122 middle and high school students. And what those students told us overwhelmingly is that marijuana is much easier to access than alcohol. Vaping is a very significant issue with kids in our communities. Mental health is a concern, and students tend to go to their peers before they go to the resources within the schools. And there's a consistent lack of resources, these kids told us, about what's available to help them not only in their schools, but in their community. Another piece of data is more recent. The Communities That Care Student Survey is something that happens statewide, and schools have the opportunity to participate. We are very fortunate that all the schools in Douglas County participated this year. That data from this past spring had said the 30-day use of marijuana among our kids is higher than the Kansas average. Students report a high level of poor family management, so a lot of dysfunction in families. 33% of students report feelings of depression, and this is before the pandemic. And almost 19% of students report seriously thinking about hurting or killing themselves. So some really concerning data coming from our kids. Another piece of data, we are in partnership with Lawrence Memorial, Burt Nash, and some other folks in the community to gather data to look at a snapshot once a year. So this piece of that snapshot is DECA treatment admissions over the past 3 years. And you'll see our outpatient facility and our First Step residential facility. Those are unique people, not duplicate admissions. So you'll see just the volume of admissions that we see in this community. And then we looked at admissions by treatment modalities, so the level of treatment that folks are receiving. You can see on the far left, the number of assessments have increased, so people coming to us are being referred to us, trying to determine, do they have an issue with substance use? I'm going to talk more extensively here in a minute about our social detox project, but these are folks who are coming out of the emergency room and need a safe place to come down from the substances they've been using. Our residential facility is our women's facility, and you will see those admissions have remained fairly steady over the past 3 years. We have two types of intensive outpatient. Intensive outpatient is 3 hours a day, 3 days a week. So somebody who may not need residential treatment, but they need more than outpatient treatment. At our First Step facility, we allow women to stay with us after they've completed residential and they're out working or trying to find a job or going back to school. And that's what we call housed intensive outpatient. And then the community intensive outpatient are folks who are living and working in the community, but still need that level of care. You'll see our outpatient services have increased significantly, and we were on pace to increase that before COVID. Peer support is something that the city's Special Alcohol Fund supports for us. These are folks who have lived experience in treatment and recovery, who are working with those we serve alongside our professional team, and really talking from that lens of, I have been there, I'm in recovery, and you can do it as well. We do quite a bit of substance use education, and you can see that has spiked over the past year. We have a special contract with the Douglas County Jail that I'm going to talk about here in a minute. And then out at our First Step facility, one of the unique things about us is we specialize in serving pregnant women and women with small children. And women can bring their kids to treatment with them instead of having to choose between taking care of their kids and going to treatment. And we have a licensed child care on site. So kids are in the daycare while mom are in treatment. Next slide, please. This is something that I want to spend a little bit of time on about how treatment is reimbursed and who we serve. You'll see on the far left a grid that is federal block grant. We receive money that comes from Health and Human Services through the state agency and to providers like DECA to serve people who would otherwise not be able to get treatment. These are folks who are at 200% of the federal poverty level or below. They don't have insurance, they don't meet eligibility for Medicaid, or they don't have Medicaid. And this allows us to give them access to treatment. And you'll see it is by far the largest percentage of people we serve. And at outpatient, we've seen that go down a bit because of some of our county initiatives, which I'll talk about here in a minute. But you'll see that for the uninsured population and the Medicaid population, it's something that we really specialize in. We want to serve people that can't get help anyplace else. Next slide, please. This is that same look at First Step, our residential program. And again, you'll see by far the people we are serving are those who are the most disenfranchised. We are serving women, and in our Wichita facility, the grid would look the same, women and men, folks who have been victims of domestic violence, long-term sexual abuse, emotional abuse, physical abuse, folks who have been homeless or are currently precariously housed, folks coming out of the criminal justice system. So those folks, again, who no one else serves, and we really specialize in doing that. Next slide, please. So here's our current treatment experience. How we provide treatment right now is very different in this COVID environment. At First Step, we actually suspended admissions the end of March. We were not ready to serve people in the COVID environment. So we suspended admissions. We reopened in June, and we have reduced our capacity. Typically, we serve about 40 women in treatment, and right now we are serving 20 to ensure we can have one person per room. And I would go through the litany of safety precautions we're taking, but you can imagine we're testing and PPE and cleaning and all of those things. We're currently not operating our childcare. We are in negotiations with someone here in town to work on a collaborative process for childcare. And so the only children we're taking are children under the age of 6 months who can actually be in treatment with their moms. And I just want to offer you a snapshot of our diversity data. 67% historically of the women who come to treatment at First Step are Caucasian. 25% are persons of color, and you can see the breakdown, primary breakdown of what that looks like. At our outpatient location, all of our outpatient services statewide became virtual the middle of March. We are now back into the offices and are doing about 25% in-person work. The rest is virtual. So we have folks on Zoom 8 hours a day facilitating services. That is a challenge for people who are uninsured or unemployed, and we are working on some technology grants to give them technology to still engage in treatment. What that's done, however, is that issues of transportation and childcare, we've been able to get around those because they're staying in their homes, they're able to engage in treatment, and they're not worrying about how they're going to take the bus from one side of town to the other to get to us. And then you can see our diversity data over at outpatient. It's a higher percentage of Caucasian citizens, but the breakdown of persons of color is just a little bit different. We do quite a bit of work with Haskell in our outpatient location, and you will see that we have a higher percentage of Native American folks coming to us for treatment. So some of the treatment and recovery services here in this community, of course, DECA, which is why I'm here. Mirror Incorporated, which is another large statewide organization, has a small practice. Actually, I could throw a rock and hit their office from my window. Used to be Professional Treatment Services. Mirror acquired them a few years ago. NASH has a very specialized program for folks who have dual diagnosis, serious mental illness and substance use disorder. Center for Change is over 19th and Haskell. They are the local methadone clinic. Heartland Community Health Clinic, the safety net medical provider, does medication-assisted treatment. They're actually our medical provider. All of our women go to treatment there, and their physicians are what's called DEA waivered, which means they are able to evaluate and prescribe Suboxone for medication-assisted treatment. Interpersonal psychiatry is Dr. Sony's practice. He also does some medication-assisted treatment. Heartland Rainac is one of our partners in our county initiatives. They facilitate care coordination, so they help people get from point A to point B. Smart Recovery is a new program that was started out of the Cochran-Logan Center. It is a community-based, it's not 12-step and it's not treatment. It's kind of in the middle. It's an evidence-based model of folks who can meet weekly for cognitive behavioral therapy. There's a range of community-based support groups, 12-step meetings, rational recovery. Oxford Houses are the sober living homes that we work with a lot. And then Professional Renewal Center is, they describe themselves as the high-end provider. So folks who are physicians, attorneys, they take people from around the country and do some very intensive work here in this community. So I'm not going to read through all of these, but we are a very large prevention presence in this community. That's one of the places we started almost 45 years ago. And you can see all of the activity that we're engaged in the schools, with the hospital, and all of our initiatives are based on data. So what is the data telling us that needs to happen in the prevention world? And then the interventions are evidence-based. And you will have copies of this so you can read through these at your leisure. So as you know, the county is involved in a variety of initiatives that are surrounding the upcoming crisis center. And if you haven't been over to where the crisis center and the housing is being built, it's pretty phenomenal to see that transitional housing actually rise from the ground. But I wanted to talk specifically about the initiatives that DECA is involved in, and this has been in the past 3 years. We are part of the integrated crisis team, and our piece of that project is our social detox access project. We send people with lived experience who are specially trained into the emergency department when someone is there and is in need of detox. They can't go home. It's not safe for them to do that. They need more support. And the county is actually paying us to help them access detox, whether it's in our facilities or some of our providers in Johnson County and Shawnee County. That whole project will move into the crisis center when it's built. But for now, we are helping people get to services and then hoping to help them get to treatment after the detox is done, typically 3 to 4 days. We have a special project with the district attorney's office and the local jail. We are taking women right out of jail, and if they complete a 9 to 12 month treatment program with us, they can have their charges dropped and receive a diversion. That's a very innovative program. It's something we are piloting. We're in our 3rd year now and had great success with this program. We've had babies born in the program. We've had women get their kids back from child welfare. So it's something we're really proud of so that women can get on with their lives and not continue to be involved in the criminal justice system. We are part of the new drug court. We're the treatment provider for drug court. We have been part of behavioral health court, which is the specialty court for folks who have serious mental illness. And our piece of that is working with those folks who have a co-occurring substance use disorder. The county offers us a small pot of money to help men access treatment at our facility in Wichita. We have a a therapist embedded at the Douglas County Correctional Facility. So I have a full-time licensed addiction counselor who's working with folks who are incarcerated. And that spike you saw in our substance use education work is because of that project. He does individual therapy, group therapy, and a series of educational components while folks are incarcerated. And many of those folks come to us for treatment when they're released. Our two prevention initiatives, Engage Douglas County, is a local coalition. We are bringing different sectors of the community together to talk about prevention initiatives. We just finished our second Douglas County Opioid Summit. Last year we did it in person at the DoubleTree. This year it was 2 weeks online with national speakers providing information to the community about a variety of topics related to substance use prevention. And then we are part of a data collaborative. So all of the partners in the county initiatives are working with the health department. We're trying to look at different pieces of data to get a really clear picture of the story of what's happening in Douglas County and what the opportunities are. Next slide, please. So my last slide, here are some opportunities, and I have an ask for all of you. As the prevention director and I were thinking about what would we want to say today, you know, we have some opportunities, particularly in the schools, to enhance parental engagement, to enhance youth engagement. I know as a parent of someone who just graduated from one of the high schools, there's a lot of drug use going on in the schools. And there's so many opportunities, but there are some challenges with accessing those services. So that's an opportunity for us to continue to work with the schools. Policies within the schools, and this is countywide, are inconsistent, specifically related to substance use. So there's some opportunities for some work there. The engagement within our communities is very, very different. One of the things we are talking about as an organization is how do we engage people who may not otherwise access treatment to give them an opportunity to be engaged in services. Substance use prevention within the schools, again, is something that's really important to us. Continuing to align our data. We have multiple pieces of data, but they might tell a different story. So how do we get a better concrete picture of what the needs in this community are? We want to work to increase treatment access for the uninsured and other disenfranchised populations. Some barriers to treatment and recovery are recovery housing, transportation, and childcare. If you recall our specialty in working with folks who are uninsured, unemployed, disenfranchised, it's really hard for them to live and be financially self-sufficient in this community. We're thinking about strategies for early intervention. In many of our meetings, we talk about someone has to be in the criminal justice system, or a phrase we use, uber sick. They have to have been engaged in their substance use for such a long time in order to get access to services. So how do we move upstream and connect those people earlier? Using data to really identify needs and gaps, not just what we think is going on. And then engage the recovery community to work with us more effectively. We are professionals. I am not a person in recovery. I have many people on my team who are, but they also come to this from a professional lens. So how do we continue to engage people with lived experience to give us information about how we need to move forward? And so here's one of my asks of you. We are getting ready to launch a community-wide conversation about all these things I've just shared with you, continuing to look at data to figure out where are the gaps, where are the opportunities, what's low-hanging fruit that we can start with. And we don't want this to be a county conversation or a city conversation or a provider conversation. We want it to be a community conversation with everybody involved. And I think your role on this advisory group can be really beneficial to this conversation. So my ask to you is that when I reach out, probably to Danielle, to say, hey, we're ready to get started. If you all want to participate, we would love to have you be part of that conversation. So with that, I have a few minutes. I can be a little bit late to my 9 o'clock meeting, so I have a few minutes for questions. What would you like to know more about?
Sandra, this is Peter Carter, board member. In looking at some of your slides early on, there was a lot of information, but I was interested in some of the trends. You know, you were showing 3-year trends in numbers of people in different programs, and just looking at the overall numbers, it looked like there were several decreasing trends in inpatient services while you've got the same spike in outpatient. And I'm curious if what looks like could be a promising trend may just be evidence of lack of funding or COVID or you know, where are those trends going and what's taking us there? And is it a result of good work or underfunding, or where are we?
I might say yes to both of those, but
Okay.
so this is Sandra Dixon with DECA. Let me explain a little bit about how that federal block grant works. So this is the money to serve the uninsured. And if any of you have been in a meeting where I've been to talk about this, you will, and I'm really visual, you'll hear me talk about my box of money. Providers like DECA receive an allocation of these funds every year, and that's all we get. And so one of our expectations is that we manage those dollars so that people can achieve access treatment throughout the year. But when the money's gone, the money's gone. And so we, for years, DECA did millions of dollars in charity care because we didn't want to turn people away. And in this environment, we just can't do that anymore. And so 2 or 3 years ago, we really started managing that box of money more closely. And so we saw decreases in residential admissions. It's the highest cost service. It's low reimbursement. And so we really did begin to serve fewer people and try to put more people in intensive outpatient and outpatient and wrap housing and transportation and peer support around them. That's one of the reasons why we have seen residential go down. The 2020 data for us, you'll see an even bigger dip because most providers suspended admissions about the middle of March and didn't gear back up until the end of May, early June. And that's all COVID. That's all about COVID.
Thank you.
Hi, this is Zia Roseland, Board Chair. Sandra, thank you so much for that presentation. I have so many questions, but I know that all of our time is limited, so I'm trying to like pick the ones that I want to ask the most. I have a couple technical questions and then maybe a larger picture question. So the technical questions I have are, one, if we have a methadone clinic in town, and if that's what you were referencing with Heartland and people, how people get access to that medication. I guess I'll just pause after that.
Sure. So this is Sandra Dixon at DECA. Center for Change at 19th and Haskell is the local methadone clinic. They are an organization based out of Wichita, and they operate a clinic here. So anyone can access the methadone clinic. They have specific referral requirements, specific protocols. We have women in treatment at First Step who are receiving methadone every day from the clinic, or we have folks in outpatient. What Heartland does is a different type of medication-assisted treatment. So it's Suboxone, Vivitrol, Naltrexone, which are all medications used to address opioid use disorder and some for alcohol disorder. And you have to, as a physician or practitioner, you have to go through specific DEA training to do that. And so over the past 2 or 3 years, Heartland has, I think, 4 practitioners now. And so as an example, women can access treatment through us. They go to Heartland for medical care and they start them on Suboxone, and we help them carry through with that. Or because they're the safety net provider here in town and they have a behavioral health unit, that referral for medication-assisted treatment might come directly from their primary medical provider.
Thank you for that clarification.
Sure.
I was also really excited to hear about the Social Detox Access Project and the Douglas County Youth Prevention Board. I wasn't aware of those programs. And on this board, we were actually talking about changing membership requirements and really wanting to prioritize having people with lived experience on the board. And so maybe this is an ask to you, if you think that there's any opportunities for members of one or both of those programs to serve or to at least continue conversations with this board.
Yeah, this is Sandra Dixon. I think happy to talk with our prevention team about folks from Engaged Douglas County. And then there's a very active recovery community who's been working with us on all of our planning. And I'm happy to let them know that this might be an ask, and you can certainly work through us as a conduit to talk to those folks. And I can probably take one more question, and then I do need to get on this other meeting.
Thank you so much, Sandra. Joda, or does anybody else have a question?
Well, again, this is Peter Carter, board member. Sandra, in all of the social service funding groups that I've been associated with in recent years, one of the overarching questions is coordination of services, efficiency of services, non-duplication of effort, all of those sorts of things. And from the perspective of an organization that is pretty doggone comprehensive, could you just give us an idea overall in how you coordinate and holes in services, partners that you find particularly critical to the services that you want to see offered? Do you have general views on that? I'm sure you do. I'll stop.
Sure. This is Sandra Dixon at DECA. Yeah, I do. So one of the great things that's happened over the past 3 years with this initiative about the Crisis Center is that some of the larger partners in town, Burt Nash, DECA, Heartland Radak, Lawrence Memorial Hospital, the Health Department, Heartland Clinic, have come together and really been working on that exact question. So how do we help people get from point A to point B timely, effectively, and that we're not stumbling all over each other? How are we creating those systems? There are other people that we in particular work with. We work very closely with the Willow. We have actually Willow staff. They used to come into First Step. Now they're coming virtually to talk to our women about domestic violence and services available. The Safe Center does the same. And so we actually have an MOU with those two organizations about how we will work collaboratively to be sure women get the right service at the right time. We have worked really hard with Heartland Clinic and LMH about provision of medical services. We believe in whole person treatment, so we want to be sure folks get connected. But we still have a lot more work we can do, which is why we are bringing this group of people together at some point in the next couple of months to talk about where those redundancies in services might be, how we might kind of shift things from a DECA perspective, how we might shift things around to offer a service that nobody else does, or have those warm handoffs. You know, what we know about people who are struggling with addiction is that we have this much time when they say they're ready to go to treatment or they're ready to get help. Because if we drop them, if there are too many people involved, then they're just going to go away. And so we're really thinking about efficiency, access, timeliness, the right type of service in the moment. We're talking about harm reduction, which is different than abstinence. How do we help people move forward in their recovery? The three biggest challenges for us, and I would say the entire social service system in this community, is affordable recovery supportive housing. We have plans to build some 2 years from now. That's something I can talk to you about another time. Access to childcare, low-income childcare, it's a significant barrier. And then transportation. People just can't get from point A to point B. And there's some really cool things going on with some of our partners to help address that. But that's the biggest piece of where our coordination needs to be.
Hi, this is Joda, board member. I just want to thank you. This has been really very informative, and I really appreciate you giving us this broad overview and of what DECA offers our community. So I wanted to thank you. I appreciate it.
Thank you so much. And thank you all. Again, Sandra Dixon from DECA. Thank you all very much for inviting me to join. I'm happy to come back and have another conversation when we have more time. Danielle and Casey, really nice to see your faces after all these years by email. So you all have a good weekend. Thank you so much.
Thank you, Sandra. This is Leah Rosalind, board chair. I'm going to the agenda. I apologize for the pause. So the next item on the agenda, actually, do we still need to approve the minutes from last time?
Bushcutter, staff liaison, because we don't have a quorum, we cannot actually approve those minutes. So you will see those on your next agenda item. I think the same goes for item number 2 as well. That includes an action of adopting and approving the annual report. So that will also be on your next agenda item. I do think with item number 3, if you want to have a brief conversation about the 2021 funding application, no action is being asked of you, but given the conversation the board had a couple weeks ago with all of the changes you wanted to see, I wanted to run it by you all before we bring it back at your next meeting. At that point, that's when we'll ask all of the previous recipients or applicants of special alcohol funding to join us in that meeting so that they can weigh in on it as well. But given the extent of changes, I wanted to get your thoughts and make sure it was in line with the intent of the last meeting. So I think we can have a little bit of that conversation, but that will probably be it.
Thank you, Danielle. This is Leah Roseland. So yeah, let's take a look at that application. So that is agenda item number 3, I believe that Danielle said. Danielle, before we get into the aspects of the application, a technical question, when is it due? When is it due by the agencies?
Danielle, Bushcutter staff liaison. I think that's some of the conversation that the board needs to have. I think you could start that conversation now and we could build it into some of this general information that you see kind of on the first page of this draft application. But I do think we need to start having that conversation about timing. This is for 2021 funding. We don't actually, based on the distribution language in the agreements, those dollars don't go out until early second quarter of 2021. So there's a little bit of flexibility in there, but if you want to get a recommendation to the commission by the end of this year, we should have that conversation about how long do we want the application out, and then we can work on when this board then would need to meet in order to review those and have some of those other conversations. I know it has been brought up that the review of the applications, you all may want to change a little bit and have it be more presentation oriented now that there are going to be fewer applications. So I think all of those things are wrapped up in this conversation. And I think will really be answered or solidified by you all at that October meeting.
Thank you, Danielle. Is there a deadline by which the commission approves it, or do they just approve the line item for the fund, but not the specific agency funds?
Danielle, Bushcutter staff liaison, we did change it this year. So the city commission in their budget that they adopted a couple weeks ago did approve an allocation amount. So basically a pot of money dedicated for this specific purpose that then you all can come back and say, okay, this is how we would recommend you spend those dollars.
Okay, thank you. And I apologize for another question. Is the city fiscal year, is it July, or what is the second quarter of the city's fiscal year, I guess?
Danielle, Bushcutter staff liaison, it is calendar year. So January to December.
Okay, thank you.
You're welcome.
Okay, so this is Leah Rosalind, board chair. So I'd just like to put it to the board. Would you all like to have an opportunity to review the application and discuss it now? Or would you all like to have a chance to look at that on your own time and come to the next meeting prepared with recommendations?
Peter Carter, board member, I would be interested if Danielle wouldn't mind just kind of walking through the changes that you made, and with particular focus on what you did to make the clarity of the questions, to make it more transparent, and also what changes you made to implement the I forgot, the logic model, how, so to help me recognize those pieces as I wade through the pages. Would that work?
Danielle Bushcutter, staff liaison, yes, I would be happy to do that. So let me go ahead and share my screen. And I can kind of talk through the various changes that have been made based on the conversations that you all have had. So first and foremost, I tried to take the front page of Coffeyville with the format of Manhattan, with portions of the logic model, and then include a question in there about equity as well. So that's my attempt at that is this, and so it's certainly not perfect, so I hope you'll give it a really good kind of once over, because the other thing that I really heard is that we want to be cognizant of agencies and not completely change everything in this either. And so what has kind of transpired here is, apologies about that. We provided this kind of overall kind of overview page of the application. So it talks a little bit about the legal requirements. So it talks about Charter Ordinance 33, and in that talks about where special alcohol where alcohol dollars go in our budgeting process. And then this down here is really just summarizing those key bullet points in that Charter Ordinance 33 that we went over to talk about these are the areas we can spend these dollars on. So I won't go over that. It's verbatim of those bullet points.
Danielle,
yeah.
can I interrupt you for 1 second?
Absolutely.
So, this is Leah, the board chair. This does relate to the application, but it's a larger question about, since we're not seeing the social service funds awards, how will we get that information? And I guess I'd like to have some more understanding around, like, if there are programs that are funded in the social services pot, how that will factor into our funding decisions. So it's not a technical question about the application, but I think it does relate.
Yeah, Danielle Bushcutter, staff liaison. I think that's an excellent question. I don't know that we have a great answer for you. So one of the things that we've been talking about with those general fund dollars that previously this board has reviewed is tying that application to our strategic plan. And we made efforts to do that previously. But now that we will hopefully have a new strategic plan in place relatively soon, again, I think that application will be tied to that maybe a little bit differently than it has before. And because we don't yet quite have that strategic plan in place, because we've had to put everything on hold with COVID, we don't quite have that process identified and the timing of that identified. My hope is in the next couple months, as we continue to talk about this application, and you have kind of those additional meetings later this year, that we'll be able to provide you some additional details about what exactly that's going to look like and how all of this is going to tie together. Because I think that's an important element, and I know it's something particularly over the last couple of years you guys have really talked about, is maybe we spend more dollars on the special alcohol side and less on the general fund side, or vice versa. So we'll keep talking about that, but I don't have a great answer for you yet. Mm-hmm. Okay, so I'll jump back over to the application. So just a brief paragraph stating that you all are going to be the ones reviewing and making a recommendation to the commission, who will ultimately make the final decision about the allocation of these dollars. just some kind of general information about collaboration and the importance of that, and to the extent to which agencies are able to partner together, that is encouraged. I don't know that we've ever written that down anywhere, but I think in a lot of the comments that I've heard from board members, it's something that we talk about a lot, even though it hasn't really been written down. And then again, on the front end, sharing with agencies what the reporting requirements are going to be if they are awarded funding. And again, I mentioned this distribution of funds to acknowledge that, again, the first distribution will not occur earlier than April 1st. And this is in all of the agreements that we sent to agencies. But this way they can see that on the front end instead of having to wait until we actually send them that application, or that agreement, I'm sorry. So this first part is the same. I changed the formatting a little bit just to give it's a little easier on the eyes in a format like this compared to what we've had before. So none of this changed. To Leah's point earlier, we're going to have to figure out how exactly we want these meetings to look, because that may change a little bit of this verbiage if we want to share with people that they need to be available on this date for a 15 or 10-minute presentation, something to that effect. This names and titles of persons responsible for program supervision and/or financial administration of the program is something from that Manhattan application. So these next couple sections I kind of took directly from their application, but I think hopefully is in line with the intent that you all had initially. So in our actual application, we'll still have it be online. So this will be something that I think we can, if they need more rows, things like that, we can accommodate that. This again is from that Manhattan application. And so this just kind of gets at those handful of different categories that we can spend special alcohol dollars on to try to get at what are we talking about? Does this program really focus on prevention, detox, intervention, law enforcement, education, or other activities, as determined to be appropriate by this board and the commission? So that is new. This looks a little bit different, but we have asked this question previously, and that is whether or not the agency requesting funding is receiving other dollars from the city in some capacity. So general fund may be a likely source. CDBG, Housing Trust Fund are probably those key areas that agencies may be receiving funding outside of this particular process. And then added in these two questions. They're kind of similar to some of those 990 questions, but for the current year. And again, this is something pulled from the Manhattan application, but the total operating budget for that particular agency in the current year and the previous year. These next few sections, I didn't really change other than the formatting. Sorry, my mouse is very sensitive. So still talking about how it aligns with Charter Ordinance 33. What are the long-term effects of this program? And then kind of talking about, family history, community. So all of those are the same that we've had in the application previously. The section 3, which is the statement of problem and need. Again, I did not change much here, just kind of rephrased a couple of the questions, but all of this was relatively minor. I can't remember if we added this or not, but just kind of this emphasis on including statistical data to really determine that need that is being talked about. So again, those questions didn't change. This description of program services did change a little bit. So this first question is status quo. We've had that previously. But this is where we start to try to get at kind of that equity question. So in putting this together, it was a little challenging because a lot of the documentation that we have been looking at really is kind of that full program analysis about how equitably services are being provided, kind of like the example I shared with you all a couple weeks ago with the health department. That's really to get a deep dive. So it's hard to pull just one or two questions. We also are a member of GARE, which is the government, I can never remember, Equity.
Alliance on Race.
Alliance on Race and Equity, thank you. I have to think through it every time. But they have some really phenomenal toolkits. But again, it's really kind of that deep dive on policy and making sure that the policy has an equity lens that's being used. So I tried to take some of those different resources and boil it down to one question or two questions is what I have here. But I think this is a really important element, and so I hope you all, particularly in this area, I know there's a lot of interest, take a really critical look at this component of the application. The other changes that we made were kind of in this how many clients will be served and describe the target group you are hoping to work with to get at kind of that logic model. I think some of the other elements of the logic model are in various questions throughout the rest of the application, kind of sprinkled through, but this deeper dive and deeper focus on who is going to be served, who is going to be impacted, I think was that one piece that was really kind of missing in that logic model that we've used before. A lot of those other elements you can kind of tie back to different components of this application, but this one I really felt was lacking. This next section is objectives. Again, the logic model talked about different types of objectives. So I think that's one area that here we leave it pretty broad and open to say you need 3 specific objectives. They need to be measurable. You know, there needs to be a timing element to it, all those sorts of things. But we don't talk about, you know, you need 1 process objective, some of those things. So that is an area that I think I would appreciate any feedback from you all on kind of that component, because this is kind of maintaining status quo. And then the budget information, really just trying to take the form that we had on our online version and make it and kind of put it in a version that's a little bit easier to read on paper. So these categories and these elements are all the same. We did include an explanation in our application previously as well, so just giving a little bit of space for that. Same thing on the revenue side. The only substantial change here is kind of breaking out what you're requesting from special alcohol funding versus those other city sources. So that's one change, and then kind of noting what those key sources may be. And then here, the percentage of the program costs that are being requested from the city. And so the note here that has been added is that this percentage would include the amounts in both of these boxes. So looking at the city as a whole, not just the special alcohol side. So again, I would be interested in your feedback kind of on that component of it as well. And then this all has stayed the same, just giving folks space to actually type in those numbers in kind of the online paper version. And then finally, we've included this in some of our other applications or a version of it, just an actual signed note saying that, you know, all the information that has been provided in the application is accurate to the extent that can be known at the time that the application was submitted. So we do something similar to this with our economic development applications and our housing trust fund applications. I took this verbiage from the Manhattan application, so if you're not interested in having that, that's another element that was added as well. So I think that's a very brief overview of the changes that have been made. Certainly happy to get kind of initial feedback, but am also happy to just move this to kind of that October meeting for a really in-depth conversation. I think that'll really be the bulk of that meeting. So if you guys want to just sit with it, that's perfectly fine as well.
This is Leah Roseland, Board Chair. I would like to make a recommendation. I know that in review, thank you, Danielle, first of all. That was really helpful. And you did a great job at incorporating all those changes. I appreciate you so much. I know that I have sort of a series of questions that I have or changes that I'd like to recommend be made. And I'm not sure that we have the time allowance this morning to get through all of those. So what I'd like to recommend is that we prioritize setting a deadline for the application, that we set our next meeting date, and that we all the board members come prepared just to the September meeting, having already submitted some questions or recommended changes, or at least reviewed it and have those in writing, so that we can really work through all of those in September with the goal of getting the application finalized in September. I'd recommend that we release the application no later than November. And if disbursements start being made, and I believe you said April, then it sounds like we need to have those approved no later than what, January?
Danielle Bushcutter, staff liaison. I would say definitely no later than January. There is quite a bit of work that we have to do in terms of getting agreements put together and signed and back and all of that before we can distribute funds. So my recommendation would be potentially having the application open throughout the month of November, and then maybe having a longer board meeting sometime in December, which I know can always be tricky to get those scheduled, but if we can do that early, may be possible to do, so that we can get it on a city commission meeting, late December, early January, and then we can start working through those agreements, with those that are awarded funds.
Great, thank you, Danielle. So this is Leah again. What does the board think about that recommendation? So finalize applications set in this next September meeting, get them released no later than November. It sounds like preferably October if we can get our work done in September, with a deadline to review in December, to review and submit recommendations in December.
This is Peter Carter, board member. In that time frame, do we see getting feedback from agencies who might be using the form, getting their recommendations? If that's a possibility. To your point, Leah, I vote yeah. I would love to get this thing ironed out and move forward. And to second Leah's comments, Danielle, I really appreciate the way you took all of our words from the last meeting and distilled it into something semi-meaningful, which, yeah, thank you for that. That was really great.
This is Joda, board member. I really appreciate it too, Danielle. You really did a great job of consolidating all of those applications that we appreciated or we admired, and putting them all in a document for us to look. I agree. If we could go ahead and, it would be nice, Peter, like you said, if we could actually get some feedback from some of the agencies, but then to Leah, your timeline, I think that's really good. If we could kind of meet to discuss those applications by December, prepared for next year, that would be great.
This is Danielle Bushcutter, staff liaison. Would it be helpful for that October meeting if we come to that meeting kind of as staff, I envision that being the meeting that we invite those agencies that have requested special alcohol dollars previously, if they want to participate and provide feedback. But at that meeting, we could do kind of a formal presentation about the application, really highlight the key changes, some of those key conversations that the board has been having over the last year or so. Open it up for public comment, which would hopefully we'll get some agencies that would like to participate, whether it be virtually or through written testimony, what have you. And then at that meeting, we can include kind of a proposed timeline. That way we can also set future meetings that we may need from the board. You all can make that final decision about whether or not you want presentations and what that's going to look like, because that may inform how much time we need, that sort of thing. Would that be helpful to board members as we move into that next meeting, October 2nd? All right, I'm seeing general head nods and thumbs up, so that is how I will proceed, and I will get those invites out to all of those agencies probably a week or so once we get the agenda published.
Thank you, Danielle. This is Leah Roseland, board chair. I had one other question actually about the ordinance, Danielle, if it's okay to go there for a second. So I see that it's actually in the city ordinance that the funds can be used for law enforcement, prosecution, court activities, programs, or portions thereof relating to apprehending, prosecuting, adjudicating, or monitoring individuals who are alcoholics or drug abusers, which is language that just hurts my heart, or who are in danger of becoming alcoholics or drug abusers. So I'm assuming that there was some intention when that ordinance was passed of including that rather harmful language, or designating funds to be utilized for penalizing people with drug addiction or alcohol illnesses. And so I'm wondering what the process is for getting that updated with more current language, first of all, and even having that section updated so that we as a community can really evaluate whether it's the best use of city funds designated to treat and prevent drug and alcoholism to use those funds for the detainment or et cetera of people with illness. So I just wanted to raise that question and ask what the process for getting that updated might be.
This is Danielle Bushcutter, staff liaison. Casey, I would certainly defer to you on this a little bit. It is a charter ordinance, and I would have to go back and look at when it was actually adopted. I can't remember the date offhand. So there is a more lengthy process for doing that, not to say that it couldn't be done. But Casey, can you talk a little bit about what you would anticipate a process like that looking like?
I can try. This is Casey Toomey, Assistant City Manager. I believe, and I too would have to pull it out, but I think when there's a charter ordinance, I believe there's a 90-day sort of review period. So it would require a city commission action. So you all could make a recommendation with the language that you thought was appropriate. It would be a city commission agenda item. Then there's like a 60 or 90-day period where anybody can make public comment on that. And then at the end of that period, then the city commission would take an additional action to approve that ordinance. So I too would have to go back and look, and in the city code, I kind of think that it has the date of when it was updated the last time, but I think, Leah, your comments are valid, that language is probably a holdover from a time when that was the nomenclature that was used. So I think it certainly would be within the purview of this board to make that recommendation to update that language and even to have that bigger conversation that you described about, is this still something we want to use these funds for? The timing, I'm not sure, you know, I don't know if there's timing for that lengthy process for this round, but perhaps you could do it simultaneously with the thought that then it would be in place before the next round.
Thank you for explaining that process. This is Leah Roseland, board chair. Are other members interested in taking a closer look at the language and allowances in those ordinances?
This is Peter Carter, board member. Yeah, absolutely.
This is Joda Totten, board member. I think it's an excellent idea. Really a good idea.
Great, thank you for your feedback. So it sounds like, Danielle, could I ask if you or Casey could work with me and sort of the timing of when that would fall on the agenda, given the other work that the board has, and wanting to prioritize getting the applications passed, of course, but not wanting to let this slip by either.
Yes, this is Danielle Bushcutter, staff liaison. Certainly willing to work with you on that. And we can also leave kind of a note on future agendas too, that this is some of the work that the board is plans on taking up, because we may not be able to get to it just with timing of the application. And I want to be sensitive to your time as well until 2021. But I do think it's certainly something that we can start working on, and we can get with our attorney's office and start talking to them about that as well.
Wonderful. Thank you so much. This is Leah Roseland. So it sounds like the board has homework to prepare for the next meeting. We're going to go through the application carefully and take note and submit any recommended changes that we have in advance of the meeting if possible, so that those changes can be incorporated into perhaps a new draft in the September meeting. Is that what we're saying? Or are we going to go over the changes in September?
This is Danielle Bushcutter, staff liaison. I would prefer if you all want to get me your individual recommendations, we can kind of backdate. I want to get the agenda out about a week ahead of the October 2nd meeting, and so I probably need a week to get all your comments together. But if we can figure out that date, I could certainly incorporate that into the memo to say this is the feedback that was heard. I don't want to change anything without there being formal board discussion on it. So that would be my preference in terms of how to move forward if the board is comfortable with that.
This is Peter Carter, board member. Just so that I am clear on expectations. So, you know, I'm very happy with the idea of us doing homework, getting our thoughts on your recommended changes to the application process, getting those comments to you within the next few weeks, like get them to you in September. And you're suggesting, Danielle, this is actually a question, that we get those to you so that they can be ready for our meeting in October.
Danielle Bushcutter, staff liaison, yes. So if you all would be able to get me your comments by September 18th, and remember, just send them directly to me so we don't violate any Kansas open meetings requirements, I can then get those noted in the agenda item that I put together related to this particular item that will then go out on the 25th of September.
Very good, thank you.
Mm-hmm.
All right, it sounds like we have a plan to move forward. Are there any other comments or discussion items about this agenda item, or are we ready to move on?
Move on. It's Joda, board member. Move on.
Okay, I am going back to my agenda. So let's see. I apologize. apologize again. I had to go back to it. So consider agenda item number 4, consider adding, oh, okay. So we're just approving that meeting date essentially, Danielle?
Danielle, Bushcutter Staff Liaison. We can't actually take action on that item. However, I will go ahead and send that out. I did include the results here. Everyone indicated, at least initially, that they would be able to participate in that meeting. We haven't typically had these on the agenda for previous approval. I would like to get to a place where we start, but we will. I will still go ahead and schedule that meeting and get it on calendars today.
Okay, gosh, dang it. Someday I'll get a hang of this. All right, so with that, I don't see, are there any other agenda items that I'm missing, or can we get a motion to adjourn?
This is Danielle Bushcutter, Staff Liaison. I think the only other item is public comment, and we don't have anybody here who is wanting to make public comment. So I think with that, you can, as chair, we won't actually move to adjourn the meeting, but you can declare it adjourned.
All right, well, we are adjourned. Thank you so much, friends.
Thank you.
Thank you. Bye.
Thanks so much. Bye-bye.
Thank you.